My name is Hoyne. I'm a consultant psychiatrist, and I would like to give you some information about a paper published in Global Psychiatry Archives, Volume 9-ish, 2026, and its effect of brief intervention on readiness to change and treatment initiation in patients with hypertension using tobacco. It's from Rimmi, Gautam, and a team from Uttar Pradesh in India. The study includes 80 subjects who are all using tobacco. 77% were using smokeless tobacco, and initially the majority were in the contemplation phase, 10% in the action phase, and only 2.5% in the maintenance phase. And later this changed, and the intervention was come back to the change. The intervention was brief, 20 minutes, about. Um, it consists of 5 A's. Ask, so asking about the tobacco use at every visit, and give advice, provide a personalized message to stop tobacco, and provide information about the benefits of quitting. Assess was about the interest in stopping. Assist was setting a date, providing support and guidance, discussing strategies to stop tobacco, and providing educational material, some counseling, and sometimes referring the client to specialized smoking cessation programs. And then there was an arranged phase, which was more or less to organize the reassessment. So what happened with these 80 subjects, which had different age ranges, and some of them had several attempts already to stop smoking or using tobacco. And here's the summary. Initially, they had 70 people in the contemplation phase, and later 64. The action phase, where stopping started, was 8 to 12, so that increased by 4. And the maintenance phase, where it was about keeping off the tobacco, was increased from 2 to 4. So in total, there was some effects. These effects were not great, but considering that there was a relatively short intervention, that's not too bad. So the total take-home message is that the brief intervention on readiness to change and treatment initiation in patients with hypertension using tobacco is effective in a small sample or subsample of the patients of a cardiology department, even though the intervention focusing on smoking or tobacco use cessation is relatively short. So more information on this is needed, and this is a highly selected sample. I hope you are interested in this, and you can read the full paper in the journal Global Psychiatry Archives, which you can Google easily. Thanks for your interest, and have a nice evening.